Hey guys, I'm Sebastian. Are you dealing with lower back pain that tends to get worse with bending forward and it's worse in the morning? It's okay when you lay down, but especially on your belly, but it's really not good when you bend forward and put on your shoes and tie your, I guess you can't tie your socks, but especially when you're seated. If this is you and it tends to get better when you walk, then I think this video will be very enlightening to you, okay? What we find a lot of times with people with back issues is that a lot of times it's not always an inflammatory thing. It doesn't always need surgery, and it doesn't always need medication. It's simple movement-based corrections, simple exercises that you can do at home, and building up strength within the hips and core endurance will usually help them. And I'm going to show you with one simple movement right now about what I'm talking about, all right? And so I'm going to pan this thing back since I don't have a camera person and just show you one simple test we do in office with people to give them a good idea of if we can help them or not. If this test works, a lot of times we find out that they can actually make a big change in their symptoms within even a couple weeks, and then we just have to keep them out of pain. We have to build some resiliency. And so usually what I'll do is I'll sit them in my chair right here, and I'll have them sit however they want to sit, and I say, does that hurt? And they say, no, it doesn't hurt that much. And I say, okay, so give me some bad posture. And they say, yeah, rounding the spine right there. I don't really like that. That's my pain. And so all we got to do next is to have them take their hands right here and place it on their pelvis like a dial. And we're going to turn it like a dial forward. And just ask them how that feels. If they say, hey, that feels a lot better, like not perfect, but a lot better, then we tell them that actually posture and the way they're treating their spine is actually driving this problem. Again, round the spine, get slouchy and low, dial the pelvis, see how that feels, which straightens out the spine and helps deload certain areas of the spine, specifically the low back disc, okay? So if that was helpful to you and you're looking for some guidance, just reach out to us. We'd love to talk to you about this. Our programs are solid. They're exactly what we do at the office with people. And we encourage you to go talk to your physician about what's going on with your back to make sure there's nothing scary going on. But for the most part, most people do not have big, bad, scary things causing their back pain. And most people do not need surgery. You don't need to have bed rest as long as you think. And most people don't need medications. And we can simply do stuff with a good movement-based correction, such as what I mentioned here, and some good solid exercise, good solid resistance training that'll keep your body resilient and strong. Love to talk to you about it in the future. Reach out to us.